Let's bring in NBC News medical contributor Dr. Natalie Azar. Dr. Azar, always great to have you. So first, I want to get your take, of course, on these new coronavirus strains. First, we saw one from the UK. Now we've got one from South Africa. How concerned are you about this? And talk to us about how effective the vaccines are against them.
Well, certainly any mutation is concerning, Savannah. And remember, we've talked about this. We are concerned about whether or not a mutant strain is going to spread more easily, whether or not it's going to cause more severe disease, or whether or not it's going to evade protection from a vaccine. Thus far, perhaps there's some increased severity associated with the UK variant, but we don't know. We don't have that data yet regarding the South African variant. But I think the South African variant is really the one that's making news right now, because both Moderna and Pfizer reported this week that its vaccines were less effective at generating those important neutralizing antibodies against the mutant strain. But this was laboratory work. This was not evidence in the real world. Remember, Pfizer and Moderna were studying their vaccine at a time when the South African variant was not circulating. So what this means is that I can't tell you, nobody can tell you right now what that translates to in terms of effectiveness in the real world. That is, the Pfizer is 95% efficacious. Moderna, 94%. Does that number drop to 90? Does it drop to 80? We don't know that yet. But what experts have said is that in spite of that, the vaccines will still likely offer a good cushion of protection against the variants, and importantly, very likely prevent severe disease, which of course, is the thing that can lead to hospitalization and death.
Absolutely. Doctor, also, we're learning about a possible new symptom of coronavirus. It's called COVID tongue. Explain what that is, what researchers are saying about it, and also for you as a medical professional, how mystifying is it that these new symptoms keep coming up?
Okay, so we have said from the very beginning about this disease how protean it is. Remember back in the day when we thought, wow, loss of taste and smell, that's so unusual. Now it's part of the CDC criteria. So COVID tongue, as it's been dubbed, is not yet a recognized criteria per the CDC. But what is happening is sort of this grassroots accumulation of data. I just had a patient last week, who had funny changes in her fingers, and I reached out to a dermatology colleague who said, yes, I've been seeing this as well in my COVID patients. This is how it all begins. Look, mouth changes, oral manifestations of disease is not new. Many folks know that they get, canker sores and things like that when they get a viral illness. So this isn't necessarily unprecedented. The COVID tongue specifically, well, it could be swelling, inflammation, irritation, patchiness, indentation, a whole variety of things. It's not seen in the majority of patients with COVID-19. It's very likely related. I don't know that it has been formalized as an association yet.
And Dr. Azar, I want to talk to you about vaccines again just for a moment here. People who are not in these priority groups are lining up at vaccination sites, hoping to get leftover doses before they go to waste. And we have been hearing about some going to waste. These people are being called vaccine chasers. First, let's listen to what a couple of them had to say.
I'm really glad they're prioritizing older people right now, but if there's any chance I can get it, it's totally worth staying in line for all day.
I'm not taking a vaccine away from anybody. It's just extra that will be left over.
Dr. Azar, what's your take on that?
Well, first of all, I see nothing wrong with that. If in fact those doses would be going into the garbage afterwards, I think that's completely reasonable. What concerns me about that is that either the setup or the utilization of the vaccines is not being monitored well enough or executed properly, so that either the right amount of doses is not being calculated or able to be withdrawn from the vials, or they haven't set up a situation where the supply is equaling the demand. But just in terms of a quick answer to your question, Savannah, put it in someone's arm. Don't put it in the garbage.
Love that. All right, Dr. Azar, thank you so much. Good to see you.
Yeah.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.